Thank you, Lynn, and thanks to all of you for coming and tuning in on the web and other ways. And thanks very much to the IOM and to the Planning Committee for so rapidly pulling this together. I thought I'll just take a quick step back and give you a little bit of perspective. I came into this position in 2009, just as H1N1 was ramping up. And maybe my second week on the job, I ended up on a phone call with 10 intensive care unit physicians from around the country, each talking about their 8 or 10 patients who were in ICUs with H1N1. And a group of us listened to them and said, gee, if we could get a download of cases like this over the next couple of weeks, it ought to be possible to put together some information about how it is that people survive this disease. We went out to NIH. We worked with a research network. They agreed to modify their protocols for sending de-identified data. And we thought we were on our way. Well, it turns out it took 6 months for the local IRBs, the Human Subjects Committees at the respective universities, to approve these changes to the protocol. And we completely missed the window to know potentially how best to treat people with H1N1. 18 months later, we learned from this work that about 40% of the children who died from resistant staph, not from H1N1. And it was with that I said, gosh, we are not as equipped as we need to be across government to do science, to do the kind of research that needs to be done in an emergency, either to affect the course and trajectory of that given emergency or to be sure that we are never in the same situation twice. And so it is in that spirit that we're holding this workshop today. My office has launched a fairly comprehensive science response initiative, which is now across HHS. One immediate outcome of that is that there is now a public health emergency IRB out at NIH. It is nascent, but it could be used in an emergency. Another immediate outcome of that work has been the process that has set up this meeting. In any emergency, it has seemed to us that it's important to get groups of experts together, not only inside government, but outside government, to identify what the research priorities were and to put them out for consideration and review. So in that spirit, we now have a standing arrangement with the Institute of Medicine so that in the event of an emergency or a disaster or just another public health crisis, we can ask them rapidly to convene a group of experts, that would be you, and other interested parties, and help identify what the research priorities are that will help manage this acute event and help us not be in the same situation next time. There is a lot of science already going on, and I don't want you to think there isn't. For example, vaccine candidates that have been developed and are promising are now finishing safety studies at NIH and Walter Reed, and hopefully will go into clinical trials in West Africa in December. Similarly, a number of therapies have been developed, are in various phases of testing, and will be subject, we expect, to rigorous clinical trials. So those things are not the focus here. Similarly, a group has now put together, is finishing the development of clinical practice guidelines for use in West Africa for the same set of reasons. We've got to do immediate things to manage this epidemic. So I want you to understand that that's kind of science that's going on and does not need to be the focus here, but the focus really needs to be on impacting the public health and medical response for this and for the future. During Deepwater Horizon, after Deepwater Horizon was over, we pulled together all of the different federal agencies that were involved in doing research during that event. We learned that there were 17 different federal agencies, all of whom were involved in research or science in one way or another. They largely didn't know about one another. And because of the way they collected a lot of their data, it became very difficult to leverage all the tremendous work that has been done. In this event, under the auspices of the Office of Science and Technology Policy at the White House, all of the different agencies ranging from HHS to the Department of Transportation to the Department of Energy and beyond have come together to identify what it is that they can bring to this fight, what it is that they are doing, and identify both priorities and opportunities for collaboration. However, we do need to hear from people outside of the federal government about this, and that's part of the genesis for this. When we planned this workshop, we were in a very different situation with this epidemic than we are now. We had not yet had a case or cases in the United States. And so we're going to be a little bit flexible today in terms of how we think about this agenda and how we identify together what the science priorities are. But regardless, we started seeing early that the public and the healthcare workers had many concerns about how to protect themselves, both in West Africa and here. Environmental issues, as Dr. Goldman said, always come up in situations like this, both to guide the public health response and to address public concerns. I don't know how many of you saw, for example, a piece in the news this weekend about some of the challenges, not only with incinerated waste from the patient's apartment in Dallas, but the fact that right now the ashes from his cremation remain in limbo because there's not any place that will accept them. So again, speaks to the need for this interface between science and dealing with public policy and dealing with public concerns. This is not an exercise in coulda, shoulda, woulda. It's not an after-action report, and I really want to stress that. I really am hoping that today that we can focus on actionable work that will help us move forward to protect the public's health, both here and potentially in West Africa, and work that should be prioritized now. I want to stress that I'm really looking for this workshop from a sense of priorities, not just good issues and ideas. Some of that prioritization process, as Dr. Zhao said, will have a time element. What needs to be done now, either to answer important questions or to be posed to answer those questions in the future. And that involves also the collection of data, the collection of specimens or whatever. And finally, as both the other speakers have said, let's please keep in mind that this is a workshop. It is not a consensus process. It is not a process to develop formal recommendations, but it is a process to give us in federal government and the scientific community, frankly, around the world, a sense of what you all think are the priorities are. So thank you again for being here and very much look forward to the deliberations of the day.